Welcome. Today we're going to talk about the evidence-based root causes of anxiety and depression, and of course, what to test for. Hi, my name is Dr. Arianne Missimer. I'm a functional medicine practitioner, a doctor of physical therapy, registered dietitian, mindfulness instructor, and I'm the owner of the Movement Paradigm Integrative Health Center in the Philadelphia area. And today I want to dive into this very important topic because as practitioners, we have a responsibility to help each one of our patients be able to identify their specific root causes and be able to test them and of course intervene appropriately while respecting where they are in their nervous system and having compassion for them and empathy for them along the way. There are two situations that I see all the time. One is that they feel like they're failed by conservative treatment. They've gone to psychologists and psychiatric practitioners that are prescribing medications and they are still feeling these significant effects of mood disorders. And then the other situation is where they actually have gone to many functional medicine and integrated medicine practitioners, and they feel completely overwhelmed by the amount of testing and the amount of supplementation and recommendations that they need to follow. And so I really believe that it's important that we look at all of these potential root causes, but then respecting their journey and having a systematic approach to being able to identify what tests do they need and when, and how important is it, and be able to prioritize, and then also being able to complement their nervous system state. So whether they are in a fight or flight or they are in a freeze state, whether they've had trauma, and being able to prescribe these things at the appropriate timeline for them so that they can truly have hope and begin their healing process. So let's dive in. According to the World Health Organization, depression attacks nearly 350 million people globally, and anxiety is one of the most prevalent mental health disorders affecting over 300 million people. So it is multifaceted. There are so many different influences from biological and hormonal, psychosocial, neurological, immune, that we need to be able to look at each unique individual and how these things may be affecting them. Because as I always say, I don't believe that there's one root cause, but there's normally multiple root causes, and we need to look and unpack all of those. So let's start with the biological factors in mental health, where we're looking at epigenetics and genetics, as well as inflammation, mitochondria, that all can have a huge factor in mental health. So when we're thinking about genetics, we have always historically thought that depression is genetic. So every time I've ever talked to a patient and gone through their timeline, and they say that their mom or dad had psychiatric conditions and experienced depression, they always believe that they have depression because of their parents. And while some of that is true, we do want to look at the epigenetic component because as it relates to the genes, we want to think genes load the gun and environment pulls the trigger. So yes, there can be a genetic component. However, it is not very clear that one specific gene is contributing to their depression or anxiety. And therefore, it can be multiple genes that can have an influence on their epigenetics. So when we're talking about specific genes, we might look at things that are associated with schizophrenia and bipolar, or the ApoE gene that's associated with Alzheimer's, or even some serotonin transporter genes. But once again, the mental illness is subject to a polygenic influence, and it's related to multiple genetic variants and environmental factors. So when we start to look at epigenetics, we might look into things like DNA methylation. We may look into histone modification, because ultimately these are things that can affect how these genes are expressed. So when we start to think about adverse childhood events, so early life stressors, these can be associated with epigenetic changes later in life, resulting in depression, for example. But we want to think of all the things that affect epigenetics, like our modifiable lifestyle factors. So our diet, our sleep, our light, our hormones, our exercise, all of these are going to determine if these genes are going to express themselves. So when we're thinking about mitochondrial dysfunction, I think this is a really, really powerful area to look into. And Dr. Christopher Palmer did an amazing job on pulling a lot of research together in his book, Brain Energy, talking about the different pathways that can happen as it relates to overactive brain functions, underactive brain functions, and absent brain functions. And so when we're thinking of this, if we think of our mitochondria responsible for our energy production in the cells, and if there is any type of altered neuronal energy metabolism, then this can result in these three different aspects: an overactive or underactive or even abnormal. So if we're thinking of overactive, that could be related to anxiety, chronic pain. So if we think of chronic pain, there's this hyper excitability. The nervous system is always active, detecting pain, obsessions, compulsions. When we think of underactive brain functions, we can associate that often with memory impairment or ADHD, lacking that executive function, or norepinephrine specifically that can relate to focus. We can have depression and certain aspects of depression, emotional dysregulation. And then when we're thinking of absent functions, then this can be more associated with a neurodegenerative disease or even autism. So this is a really, really powerful area when we start to link energy metabolism with mood disorders. And this can be a really, really great area to think of how we can target mitochondrial dysfunction to benefit people with mood disorders. So we move into things like immune function. We want to think about inflammation and its connection to mood disorders. So chronic inflammation, specifically neuroinflammation, has been identified as a significant factor in the development as well as exacerbation of mood disorders like depression and anxiety. We can have specific inflammatory cytokines that are released contributing to this inflammatory response. And this has been observed in people with depression. We also want to think about leaky gut when we have increased intestinal permeability that can also trigger this release of LPS, the endotoxin that can be released into the bloodstream. We can have that inflammatory response, but we also want to think that that can also cross the blood-brain barrier and also create this neuroinflammation process that can be associated with these things as well. But we also want to factor in things like allergies. So this is something that is really important to look at, whether that's a food allergy, environmental allergy, to be able to identify, is this something that may be causing some type of mood dysregulation, specifically anxiety. So I really like to look at histamine responses and even something like mastocytosis. So I did a case study on a patient with pretty significant anxiety, dysautonomia. And when we started looking into his labs, looked at tryptase, looked at a stool test, and found that there was a lot of histamine dysregulation. He had H. pylori, which was histamine producing. He had specific bacteria that was histamine producing, as well as his tryptase being elevated, indicating that he did have mast cell activation. So these are things that can cause significant anxiety that may be frequently overlooked and is absolutely worth looking into and asking questions about food and environment, their response to things. Do they have a lot of postnasal drip, for example, and chronic congestion? So just being able to look into that a little bit more can be really helpful to identify that. And of course, there's hormonal influences. So this is something that I think is much more commonly discussed. Of course, cortisol is our main stress hormone, and any type of chronic HPA axis dysregulation, of course, that is going to contribute to some type of dysregulation in the nervous system. But let's not forget things like estrogen and progesterone, where this can create mood swings and anxiety, maybe related to PMS, to perimenopause, even menopause, but also looking at low testosterone, and especially as it relates to depression in men, but also women. We want to think of testosterone as that hormone of vitality. And a lot of times, of course, this can be associated with these significant issues. So I see a lot of men are in their 50s and they're kind of chasing things, trying to figure out, why don't I feel well? And of course, it's sometimes hard for them to articulate that. But then when we start really diving into it and we look at their testosterone is low. And that is so much of why they're feeling this depressed mood. So of course, these are really important, as well as thyroid. This might again be one of your more common things that you're looking at, but looking at hyperthyroidism and of course hypothyroidism, both contributing to specific mood dysregulation in different ways. But also, as we think of the thyroid as that master regulator of metabolism and how it's affecting everything, every cell in our body. Even, of course, when we're thinking of conservative medicine, a lot of times we're not looking at a full thyroid panel. So we might not recognize that someone has Hashimoto's because we're not looking at antibodies, for example. So making sure that we're looking a little bit more in depth in their thyroid panel. And then there's also things like looking at neurotransmitter synthesis. So if we think of something like tyrosine, that is the precursor for dopamine, or if we're looking at tryptophan, for example, that is the precursor for serotonin. So this would be really important to understand if there are specific deficiencies, which we'll talk about in a moment with nutrition. So with nutrition, of course, there's a lot of different factors here, and this can be everything from nutrient deficiencies to processed food to food triggers. And nutrient deficiencies are so heavily linked with depression and potentially anxiety. There are so many nutrient deficiencies. Vitamin D has been very well researched in its relationship to both specifically depression. And there are also things like our B vitamins, our minerals like zinc and selenium, magnesium. We want to think about all the nutrients required for cofactors for different metabolic reactions, thyroid function, for example. Looking at a complete nutrient analysis is really important, whether that's a nutrient analysis they do on a platform like Chronometer, whether that's specific labs that you're testing for, whether it's you have the capability and the patient is able to do a full micronutrient panel. All of these things can be really valuable in understanding which nutrients are deficient and what you need to potentially replete with food first, as well as potentially supplementation. One of the things that I see repeatedly are diets low in protein. And if we are lacking in essential amino acids, which are the building blocks of neurotransmitters, then they are going to feel the effects of that. So looking at how much protein they're getting per day, are they getting at least 30 to 40 grams per meal? Are they getting complete amino acid profile? And also helping them to understand what its role is in mental health, I think is a really, really important aspect. Because when we just say eat protein or eat more nutrients, they don't really understand the role that these things are playing in their journey to healing. We also want to think about the protein aspect and how it is going to have a higher thermic effect of food. So it's going to have an improvement in overall metabolism. But in addition to that, it's also going to help with blood sugar regulation, which is the next key point. So if someone is in, let's say that stage 2, 3 stress of HPA axis dysfunction, then they are going to have dysregulated blood sugars. And so just by implementing eating more protein consistently is going to have a huge effect on how they feel. And it's going to give them that repletion that they need to be able to do other things. Of course, any kind of dysregulation in blood sugar can result in symptoms of anxiety, irritability, feeling hangry. And also we want to factor in the consumption of ultra processed foods. So I always say the more important thing first is to look at what nutrients we're not getting in and just starting there. But we of course want to think about what the foods that they're getting that may be contributing to inflammation in their body and oxidative stress in their body. And so when we get into these ultra processed foods with high sugar, unhealthy fats, this can increase inflammation, oxidative stress, and of course, therefore contributing to any kind of mental health issue. And then lastly are food triggers. So when we think of all the three different categories of adverse food reactions, so we have our food intolerances, we have our food sensitivities, and we have our food allergies. All of these should be assessed, maybe not all at one time, but understanding if they do have a food allergy, that again, as I already mentioned, can be something that can drive histamine responses, which therefore can cause anxiety. And then we, of course, want to think about food sensitivities. So if they are eating something regularly and they're having some kind of food sensitivity to this, then by removing these foods, we can often make a pretty significant difference. And then the last thing is the food intolerance. So if they, for example, are experiencing something like SIBO and they're eating a highly fermentable diet, then by transitioning to a low FODMAP diet temporarily to decrease their overall symptoms, to allow for improved nutrient absorption, that can be really profound in affecting their overall, let's say in this case, neurotransmitter synthesis, and so on. And we also want to factor in some of the psychological effects of hunger. So many times I'm seeing patients that are not eating enough. So they are under eating in a variety of ways, whether they are trying to restrict, they are trying to lose weight, they've been in a constant calorie deficit, or they have very poor interoception. So they don't have that good internal awareness of self to be able to know when they're hungry and when they're not. Either way, this can contribute to an increase in cortisol. Therefore, that can cause all of the same symptoms. So being able to identify, is someone under eating, and whether that is intentional, do they have disordered eating or eating disorder, and just helping understand a little bit more in depth about where they are, what the relationship is with food is really important, because these compound stressors from dietary habits can really cause so many issues. So even let's say that someone is eating at all different times of the day and every day looks a little bit different, that's going to affect them hormonally. And so therefore that can affect their blood sugar. And it can just be a little bit of a vicious cycle where they're not optimizing their natural circadian rhythm of that sleep-wake cycle of when they're eating, when they're sleeping, and it can just cause further stress on the body. Now we want to talk about environmental and physical health factors. So first we want to think about exposure to environmental toxins like heavy metals. So cadmium and mercury, for example, pesticides, mold, industrial chemicals, all of these can potentially cause neuroinflammation, oxidative stress, increasing our risk. Also, chronic infections. So things like Lyme, Epstein-Barr, these all can trigger even things like pandas. So when we're thinking of like a staph infection, all of these things can contribute to this inflammatory response, which then can affect brain function and ultimately can affect cell activity. So whether that results in more of that hyper or hypo or absent brain cell function, And then one of the things that I think is so important as it relates to physical factors, which is rarely discussed and is so important, is airway dysfunction. This is something that I screen all the time and I'm constantly referring for further evaluation. But we can do a basic airway screen in the office to look at their palate, look at their teeth. Do they have crowded teeth, for example? Do they have a narrow palate? Do they have a potentially deviated septum, small nasal valves? What does their overall jaw look like? Do they have TMJ? If we can ask basic questions like, how are they sleeping? Are they waking up feeling like they slept 10 hours and they still feel really crappy and not well rested? Then we know that they are not getting high quality sleep. And we want to really understand why. And airway dysfunction is one of the key things. So like I said, I have a great referral that I'm constantly sending to be able to uncover what might be needed to address that. But there's also really basic conservative measures that I'll talk about that you can use and implement to address that right away. But knowing that if there's things like sleep apnea, mouth breathing, all of this can lead to poor sleep quality, oxygen deprivation, which of course can cause cognitive impairments. So I love talking about the gut and the brain. So there is, of course, more and more information on this amazing area. And one of the biggest things that we want to factor in is if there is some type of dysbiosis. So is there an imbalance of bacteria that can potentially affect either gut permeability, so that leaky gut, allowing those harmful substances like undigested food, toxins, pathogens to move into the bloodstream, triggering inflammation, but also we want to think about how the gut bacteria is actually helping to form the neurotransmitters. So this whole area is really important because when we're looking at a stool test, we can understand all of the different aspects of what's happening. Is there low beneficial bacteria that, for example, as it relates to psychobiotics, is very important when we're thinking of bifidobacterium and lactobacillus and how that can affect mental health and mood disorders. So is there low beneficial bacteria? Is there high opportunistic bacteria? Is there poor digestion and intestinal health, which can mean that we're not digesting our food, therefore our nutrients? So there's so many aspects of the gut that we can look into and really get specific on how to address their gut for what they're experiencing. And of course, there's things like infections and parasites that can contribute to these symptoms as well. And then lifestyle factors. So this goes without saying, but of course, sleep is one of the most important things. I tell my patients that sleep is more important than nutrition and exercise combined. So if you're going to choose to sleep well or exercise, I actually tell them to focus on sleep first because it's going to drive everything. And so when we're looking at that, of course, we want to look at sleep hygiene, but we also want to look at things like the airway function so that we can get a better understanding if they are able to actually sleep well and how that is going to affect them. Regular activity, and not just exercise, but movement. So if someone is sedentary all day long, that is absolutely going to affect their mood. And of course, it goes without saying, but it is so common that sometimes just helping someone understand that and understand the physiology of it from a hormone standpoint. So we can think of it from endorphins, but we can also think about it from a somatic perspective and how moving our body is going to help specifically emotionally allow us to regulate our nervous system more effectively. And then we also want to think about chronic dieting, which I mentioned, chronic dieting, restrictive eating, and how this contributes to chronic nutrient deficiencies, a poor relationship with food, and then it can contribute to, of course, mood disorders as well as eating disorders. And then there's the psychosocial aspects, which is really at the forefront of so many things. If someone has experienced trauma, if they have experienced any kind of adverse childhood event or an event as they were an adult, this can have long-lasting effects and can dysregulate their nervous system, can affect their hippocampus, can affect their ability to regulate and be resilient to their life stressors. But it is also something that can be addressed through this functional medicine lens, which I think is really important. And even when I have taken the time to explain to people that have experienced tremendous amount of trauma in their life, when they are completely depleted physically, no matter what breath exercise or somatic exercise or counseling, it's going to be, the effects are going to be very minimal, because they're not really in a place where they can even be able to begin that journey and really embrace that journey. So I like to approach it is that I like to do the most basic things to be able to replete them physically. And I'll talk a little bit about that, but whether that's water or food or electrolytes or basic nutrients to help them feel better so that they are actually able to physically and emotionally deal and process some of their past trauma. If we're thinking about chronic stress, is looking at what are the stressors. So is it work, relationships, finances that are affecting their well-being? And of course, what can we do to help them shift those triggers to maybe glimmers? And if we think of Deb Dana's work as it relates to polyvagal theory, is helping them identify what those things are so that they can ultimately begin to figure out what they need to do to regulate and bring themselves back to that state of social engagement. And that leads into the HPA axis and stress response. Really just understanding that chronic dysregulation, understanding maybe where they are on, is it stage 1? Is that acute stress? Is it stage 2? Is it stage 3? And obviously there's a blend, but just being able to help educate them. I think I use that HPA axis dysfunction and general stress adaptation syndrome to be able to educate. I think it's really great visual. It's a great way to help them understand maybe cortisol rhythms, for example. If we are testing or not testing, I use that as a visual all the time. So why are you waking up at 2, 3, or 4 o'clock in the morning? And I show them, and then they can understand it. And then they understand and appreciate why nervous system regulation is so important and how to integrate it into their lives. And medication and withdrawal effects. This has been something that has been very interesting to me and very close to my heart, because I have had a dear friend go through significant withdrawal from antidepressants. And therefore, I've also worked with quite a few patients going through this. And we want to first recognize that medications in and of themselves can cause these symptoms. So that can be contraceptives, that could be things like Ritalin and Adderall, that can cause even psychoses, over-the-counter medications, and SSRIs themselves. So we do want to recognize that medications can cause these symptoms. And so when we're looking at or doing our due diligence to look at when they started taking a medication and when did their anxiety or depression start is really important. But the other thing that we want to really consider is medication withdrawal. And that if someone is planning to withdraw from an SSRI or a benzodiazepine, that it is crucial that they work with a professional who truly understands a functional medicine approach and understands a safe tapering. Because if not, they can get akathisia, which is going to create this internal terror and agitation, create severe suicidal thoughts and ideations, and can be completely life-changing. And I've seen the worst of the worst with this. And I think it's so important that we as practitioners are looking at who is on a medication and who is the right person to help them get off the medication if it is not you. And more importantly, looking at this through a functional medicine lens to be able to identify what are the things that they need to support a proper withdrawal and taper over potentially a long time. If someone's on an antidepressant, it might take one person a couple years and it might take another person 6 months, but that's going to be based on them, their mitochondrial function, their energy metabolism, their nutrient intake, their exercise habits, their stress patterns. There's so many things that we want to look at, but it's a really important area to understand. And then, of course, neurological factors. So one of the things I love to talk about is the vagus nerve, which is our connection of our gut and our brain. So 80% of our parasympathetic nervous system. And what we want to think about here is what type of vagus nerve dysregulation is occurring and why. So I have people that come see me from all over the world saying that they have a vagus nerve dysfunction. And I always like to respond with, well, we have to figure out why you're having that. Is that medication induced? Is that a infection? Is that some kind of stressor? Is that something that might be physical as it relates to forward head posture, creating cranial nerve compression? So there is always going to be a reason for that. It's understanding the role of the vagus nerve and how that's affecting them, but also still looking to unpack why they might have an issue. So the patient that I mentioned earlier that was having the mast cell activation, he had COVID and then shortly thereafter began to have all these symptoms of dysautonomia. And so we, of course, addressed a lot of aspects of the vagus nerve, but we also were addressing all of the other factors at the same time. And chronic pain. The challenge with chronic pain is that persistent pain is going to lead to persistent psychological effects. But conversely, mood disorders can intensify the perception of pain. So this can be a cycle that can just continue to perpetuate. I work with a lot of patients with chronic pain, and I think that what's always really valuable is to explain to them the why and how this can happen and how we can begin to address both at the same time. So they might have specific movement issues that we still want to respect and work through, but recognizing that their brain is in that central sensitization mode where it has this hypersensitivity to pain. So we want to respect both of those, but helping people understand that it's not just in their head is really valuable, because we want to look at how they're moving and through the world and what movement compensations do they have. But in addition to that, addressing the neurological component and chronic pain part of it. So how can you begin to look at root causes for your patient? As I mentioned in the very beginning, I think what's really important is to be able to do a super detailed timeline and really understand the patient in front of you, understand their journey, their experiences, their traumas, and be able to guide them in a very systematic way to proper testing and, of course, treatment. So when they are already significantly dysregulated, giving patients 10 tests to do and all of these interventions is probably not going to be the most effective plan. Although I'm mentioning a lot of different tests, please make sure that you consider where they are in that moment. And with that said, we want to think of things like genetic testing. So do they have any autoimmune markers, for example? Do they have any type of predisposition for any condition? Do they have MTHFR gene? What are the things that might predispose them so that we can factor in the epigenetic nature of things? Of course, your basic panels like your CMP, your CBC, but we also want to look at things like hemoglobin A1C, of course, a lipid panel to help just understand what might be happening overall from a metabolic standpoint. Doing an amino acid profile. If they are deficient in amino acids, then of course they are going to potentially be deficient in certain neurotransmitters that are affecting their mental health issues. We also want to look at things like potentially hair testing. So if we wanted to look at heavy metal analysis, because that can be a trigger for anxiety and depression, we might look into that. Comprehensive stool testing is something that I think is really, really vital, because it's going to give us such a complete picture of what is happening in their gut microbiome. Looking at autoimmune and other inflammatory markers, looking for things like infections, as well as our food allergies, our tryptase. If there's any potential, let's say, histamine issue or inflammatory issue, we can look a little bit more in depth with that. And other tests to consider would be things like an Airway screen, looking at a sleep study, looking at testing the vagus nerve. You can do the gag reflex. You can look at the uvula. You can do the uvula test, either one of those, to get a better understanding of the pharyngeal branch of the vagus nerve and how that's functioning. So I wanted to do a quick case study of a patient that I've been seeing recently, and she came in with depression that's been worse over the past 3 years. She's been on and off psychiatric medications, and it's been pretty severe, making it very difficult for her to work. She had headaches, she had severe gut issues, chronic pain, chronic fatigue, pelvic floor dysfunction. She's a 34-year-old mom of 2. And what we did within the course of 8 weeks is a very systematic way of testing and treatment. We pulled up some of her old labs that she had that were fairly recent. And then with that, I asked her to just fill in some gaps with her primary care physician that she was already working with. So we did look at a celiac panel because she has been tested before, but she is positive for the gene. I just wanted to look at that again just to rule that out. And we also did stool testing, which showed that there was a SIBO presentation, but also that she was not absorbing her fats. She also had significant antibodies to gluten. Secretory IgA was very elevated, and her zonulin, which is not the most validated marker of leaky gut, but it is the best biomarker that we have, was significantly elevated. Her thyroid testing was negative, but she did show that she was extremely low in vitamin D and ferritin. We began some basic interventions. So I talked to her about some specific traumas that she had mentioned in her timeline with me that she had not addressed. So I asked her to speak to her therapist about that and begin to just discuss that and see if she was able to process some of that. We did some basic measures initially. So we did water, making sure she was hitting her water intake, electrolytes, nutrient repletion, specifically focusing on protein. And that was, of course, a challenge for her. We implemented some Xlear nasal spray because she was presenting with airway dysfunction. So she had chronic nasal issues. She had I did an airway screen. So she had small nasal valves and a lot of congestion. We implemented that. We implemented sunlight in the morning, some sleep hygiene tips, going to bed, breathing before bed, then implemented some of the nervous system regulation. So vagus nerve, walking, somatic practices. I encouraged her to get some mold testing at home because I do think that that is a possibility. She might have had some early exposure early in life. And we also, once we got the stool test back, we realized that gluten was an issue for her and also that she was having this SIBO presentation. We initiated gluten-free and a low FODMAP plan and focused on digestion, incorporated bile to help her break down her fats more effectively, and just natural practices of chewing and breathing before she eats. And we implemented our gut healing phase 1. I like to break it up into phases so it doesn't seem overwhelming. Just 1 or 2 supplements at a time, which seems to work really well. And of course, continuing with that nutrient repletion. So within 8 weeks, she reported that her mood is significantly better. She's sleeping throughout the night and consistently, which is amazing. She's moving more throughout the day. So she's walking. She has way less pain. Her bowels are normal. And that's before we've even completely implemented the whole gut regime. But the most important thing is she has hope. She believes that she can get better, and she has trust in me and the process and her innate ability to heal her body. So that is the best part of all of it, because now anything that I suggest is going to be easy. But I was very respectful of where she was and where she's been on her journey. And I think that as providers is what we need to do, is that yes, there are lots of root causes, and yes, there are lots of tests and there are lots of interventions, but we have the responsibility to look at each patient as a unique individual, respect where they are in that moment in their journey so that we can help them and we can guide them to a place of hope and healing. Thank you so much for joining.